This is Radio Health Journal. I'm Nancy Benson. This week, if you're sick with the flu tomorrow, will you go to work anyway? It depends on your boss.
These workers see their managers coming into work sick, so they feel obligated that, hey, if my manager comes to work sick, I can come to work sick.
Working while sick when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This feeling of I don't have enough time for anything is, I think, everyone is feeling it. Just it's kind of coming from different places a little bit.
What's stressing you out? Finding time to decompress in a 24/7 world. Then,
when people exercise, often they can start off feeling kind of cranky or not wanting to deal with life and other people. And afterwards, they're like, oh, I love people. I'm ready to engage with life.
How minutes of movement can change your mood in an instant. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Flu season started early this year and is sparing no part of the country. Millions of us have already gotten sick, and millions more are likely to. Sometimes we're violently ill and can't even get out of bed. But if we have a milder case of the flu or maybe a bad cold, do we go to work anyway? Most of us say yes.
9 out of 10 employees have said that they do go to work, at least sometimes, with the cold or flu symptoms. That's a 5% increase from when we last did the survey 2 years ago. About 33% of them admitted always going into the office when they're sick.
That's Richard Deosing, district president for the human resource consulting firm Robert Half, which periodically surveys employees about their work habits. Deosing says, according to the survey, there are 3 main reasons people go to work when they feel sick.
Especially with unemployment being at historic lows, it's just a war on talent, right? Where there is heavy workloads with limited resources. So workers feel obligated to get into the office and get that work done, even when they're a little bit under the weather. Second reason is, managers not necessarily leading by example. So these workers see their managers coming into work sick, so they feel obligated that, hey, if my manager comes to work sick, I can come to work sick. And then lastly, maybe these workers don't want to use a sick day and instead would want to use it as a vacation day. So to save up those days, hey, I'm going to come to work sick.
It turns out that some people are worse than others about working, even when they're under the weather. Maybe they think they look good that way.
What the survey also found, individuals, call it that early 30s to maybe close to 40s, they tend to come to work more so when they're sick. The reason for that could very well be what you said in the optics, right? I'm a mid-level manager. I'm making a name for myself. So I want to make sure that the company knows that I am dialed in and 100% committed, so I will come to work with the flu.
Deosing says if that's how it is at your office, something's wrong. The problem is usually an unhealthy office culture.
It's creating that environment where individuals don't feel that if I call out sick, everyone's going to be looking at me. Everyone's going to be talking about me. That's not the environment you want, because you want to be able to rest and recuperate without having that added stress and to get back to work and be productive, right? If you're working while you're sick, chances are it's going to be very difficult for you to be productive.
However, employees have responsibilities to other workers as well. Deosing says a lot of the time that translates to staying home.
Look, if you feel that the flu that you have or the cold that you have is contagious, be mindful. Be mindful of spreading that to your colleagues, right? Because no one wants multiple people out at any given time, especially when it's not planned, right? That's number one. Number two, I would say if you're sick, your primary responsibility is to get well. And if you go to work when you're sick, all you're doing is prolonging that and potentially making it worse for you. I think knowing that employers should encourage their employees and certainly lead by example, that when you're not feeling well, hey, it's okay to not be in the office. Maybe if you're up to it, figure out a way where you can work remotely from home and offer that, so individuals don't feel pressured in coming to work sick. So it's, in my mind and our mind, is frankly, it's a partnership, right, between employers and employees.
However, what a lot of workers say is, I can't be out sick. I simply have to be at the office. Whether that's really true or not is debatable. But when you're sick at work, know that you're putting other people at a lot of risk of catching what you've got.
People are touching things, touching their nose, maybe touching another part of their body that has viruses on it, infectious material on it, then grabbing a door handle, and then someone else grabs that door handle and then touches their face, and voila, infection is transmitted.
That's Dr. Joseph Ladapo, Associate Professor of Medicine at the UCLA School of Medicine and an expert in infectious disease.
Even if you're cleaning your hands, that's definitely a good thing. But influenza, for example, it will spread on, if someone sneezes or something like that, and you release particles, mucus particles into the air, influenza is on those particles. So there can be kind of spread of some infections without actual physical contact.
If you come to work sick, my advice is certainly clean up after yourself. Use hand sanitizer. Create some type of separation between you and other people in the office. And let people know, hey, look, I'm here. I'm not feeling well. I'm here to do this job. And when this job is over, maybe it's because of a tight deadline, I'm going to go home. But I am going to tell you, I am here for this. I'm not feeling well, so keep your distance.
But even if you do that, Ladapo says it takes still more effort to keep everybody else safe.
If you literally had your own door from the outside, from the parking lot to your office, and you went to your office and had no contact with anyone else, and then walked out of that door back to your car and went home, that's probably the degree of isolation you would need to eliminate the risk of spreading influenza or whatever the virus or infection is to your coworkers. But it's very hard otherwise.
It's pretty obvious that we should stay home in bed when we feel simply awful. But there are times when we feel truly borderline. Not great, but not horrible. And you don't know if you should go in or not. When do you know you really should be staying home?
The dividing line, I would say, if you had to pick one thing, it's fever. So it's not a perfect marker, but in general, if you have a fever, that's very strong evidence that there's an infectious process going on, and you should probably reduce your contacts with other people to reduce the risk of it spreading. You should probably be resting and that kind of thing.
But Ladapo says if you really need to go to work no matter what, you should follow 2 pieces of advice. Number 1, use hand sanitizer constantly. And number 2, prepare for it with a flu vaccine.
A lot of people don't want to get the vaccine, but I want to tell everyone that it's definitely the case. Some people worry that they feel bad after the vaccine, and it is true that people sometimes do feel bad after the vaccine because of the reaction their body is mounting. But one thing we know actually is that when people who are vaccinated get influenza, it tends to be a lot milder. So even before you get sick, the vaccination is a way that can help you kind of, if you do get sick, have a milder illness, less symptoms. There's also data that shows less days of work missed when people were vaccinated.
After that, keep your fingers crossed and the hand sanitizer close by. You can find out more about all our guests through links on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
2019 was a year of important discoveries about Alzheimer's disease and other dementias. Making news this year, researchers learned that Alzheimer's risk genes are different in men and women. This could help explain why 2/3 of people living with Alzheimer's are women. Other studies in 2019 found that vision and hearing loss may increase dementia risk, especially when both sensory impairments are present. There are also new discoveries about lifestyle, according to Dr. Keith Fargo, Director of Scientific Programs and Outreach at the Alzheimer's Association.
A healthy diet and regular exercise are good for your overall physical health, But researchers have also found that they can reduce your risk for cognitive decline and dementia. These healthy habits, along with things like cognitive stimulation, may even help people who are at high risk due to their genes.
Researchers say a simple blood test to detect Alzheimer's earlier is on the horizon. And 2 recent announcements have increased hope for new Alzheimer's drug treatments. To learn more about Alzheimer's research and how you can participate, visit alz.org.
Of the 358 million people who live with asthma worldwide, it is estimated that 10% have severe asthma. People with severe asthma struggle to control their symptoms, like chest tightness or difficulty breathing, despite treatment. Some severe asthma cases may be caused by increased levels of a white blood cell called an eosinophil, which can be determined by a simple blood test. Many may not realize their asthma is considered severe and continue to live with symptoms. Tanya Winders is the president and chief executive officer of the Allergy and Asthma Network.
So many of us take the simple act of breathing for granted. As an advocate and mother of children with asthma, I have seen how the condition disrupts everyday life. Many with severe asthma live in fear of being unable to breathe or their next attack, which can be terrifying and fatal. Each attack puts patients at greater risk of another. If you're not able to control your asthma, speak with a doctor to learn about treatment options.
For more information about severe asthma, visit allergyasthmanetwork.org. This spot has been sponsored by GSK.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
A music degree holds certainly as much validity as an organic chem or a biochem degree, and we certainly wouldn't put a preference on either of those.
Why medical schools are broadening who they think will make good doctors.
Then, bacteria in your Super Bowl snacks. We'll tell the truth about double dipping.
If someone's double dipping, you're actually kissing each person in the room because they're pretty much spreading their saliva to the dip.
All that and more on Radio Health Journal.